Upper,
Venus,
lower arm,
palma, and foot, and many other things. Yes, you can in emergency care. Yes, you can use central venus. But now we central venus. It's maybe Yerem and the clavicular venus. But now we ask only about peripheral venus, and now I show you the main rules, like you will administrate your medicine intravenous using syringe. For this manipulation, before all times you check your medical equipment and items on your working place, prepare your manipulation table and table for different disinfection and other parts, and afterwards you start your really working practice. You first, you take what you will take. Repeat, please. It's every time it's same algorithm. First step when you start your injective practice. No, you must clean your hand after your daily cleaning or after infection. Yes, prescription list. What information you can read?
name of patient, age of patient,
allergies,
Okay.
and the
Information
dosage,
about patient.
medicine.
First part, second part, information about manipulation. It's maybe different collection. For example, next classes I will show you may use collection blood to the analysis. Or it's maybe different catheterization, another manipulation, or it's maybe medicine. What information you must check?
Name of the medicine.
expiry date, dosage.
No, it's administration record. You will see
Word number.
Yes, doses, percent and concentration and volume. How many times? Way, administration,
Time.
different way, and how many times. Okay. And afterwards, you start prepare to this manipulation. You open your medical cabinet, and first you must prepare medicine. First you prepare medicine. You found this medicine, and now you check. What you check?
Concentration,
Name
volume,
Concentration,
volume,
volume,
date of
integrity, and expiring date, and afterward clean.
color.
Can you use this solution or not? And afterwards you prepare medical items. If your patient needs intravenous injection, you have to prepare special syringe. More than intravenous, you will administrate more than 5 milliliter solution. If your patient needs a little volume, you can administrate different way, intramuscular or small volume. If your patient, sometime your patient need small doses solution, intravenous injection, medicine for intravenous injection, but more often this medicine need dilution, разведение. And you prepare special, it's maybe glucoses or natrium chloride solution, and you aspirate, for example, 1 milliliter main medicine, and add in this syringe addition solution. And when your choice, when we make choice, you check volume, and more often for intravenous injection you will use syringe or 10 or 20 milliliter. It's more convenient size for intravenous infusion. And with this syringe will special size of needle. What color of needle you will use for intravenous injection?
Green.
Green, same like for intramuscular, it's same size, and more often we will use this size for intravenous injection too. Or if you need more fast administration, you can use pink needle. You see, this is
More thicker than.
yes. Inside comes this size of needle for administration like stream, very very fast. In emergency situation, you can use it. You prepare syringe, and if you have to aspirate your solution from ampoule vial, you prepare addition needle, and our addition needle all time must be only green, only one size. You, of course, check experiment date and integrity with disposable device. After that, you clean your hands, put on new non-sterile gloves. This is very, very important. If for subcutaneous or intramuscular injection, it's not very wrong if you will do it without gloves. For intravenous injection, this is very, very important, and all times you have to work with gloves. And when you will aspirate blood to the analysis, you will use mask and goggles, special goggles. For injection, only non-sterile gloves. And you start prepare. You can comment me what I'm doing now. Prepare sterile material users. Now I
Clean the
yes,
bread.
clean the bread. What solution I must use? For urgent antiseptic ampoule base. What part of vial I must clean? Not top,
Covering
upper third. Or it doesn't matter. It's small vial or biggest vial. All time first slope. You clean upper third, 1/3 vial. Now, if need, you open this vial and
Again.
clean only stopper, only top. Okay. Wait some time and solution will dry. And prepare your syringe. Open addition needle, open and take syringe, connect, check, remove, take right position, change position, aspirate, right solution. This needle,
put
Your
your
hand
ഇത്
and
basic.
utilizate
നമുക്ക്
it.
ഇത്
Remove air bubble. It's very, very important for intravenous injection. Make sure that air absent in the new needle, and you see 1 or 2 drops solution inside the cap. Afterwards, you start walk with your patient. How you will do it?
Hello, how are you?
Okay. After that, make sure what is your patient, what is your name, what is you, and explain what you will do. Now I will get your solution with medicine. Did you have this injection before?
Do you have
Do
allergies?
you have allergic reaction? Okay, afterwards you explain position. What position maybe for this manipulation?
On the table.
Yes, if your patient can do it, you can sit on the chair, and for intravenous injection you need special table in your treatment room, special table for intravenous injection. It must be different table. Now it's wrong. One table for disinfection, and it's absolute different table for intravenous injection. Or your patient can lay on the bed. It's in the relaxed position. It's your decision. How you will do it. You ask your patient, please show me place for injection. If it's ulnar venous, remove the clothes, show me, and you can check 2 arms. You look on his arm and palpate it and ask, please sit down, I will get this injection in this arm. Your patient sit on the chair. After that you prepare special medical pill, special medical pill with water protective material. And here, is after that, if your patient without clothes, you need special clean, not sterile, reusable napkin, and layer this napkin on the bear skin. Close the skin, and only after that you prepare tourniquet for venous. It's maybe different type of tourniquet. It's maybe special tourniquet for venous, or it's maybe rubber ribo tube, and you must try and do it different, using different device. You can come to me and look at me. How I do it. Yes. When it's tourniquet for venous, you this tourniquet on the right place. Press it. And if you don't know it's right or not, you can check pulse on the wrist. If you do it like neat, the pulse will now the pulse must be present, yes, it's right. Okay, we understand. This is only tourniquet for venous. It's not tourniquet for stop bleeding. And if your pulse is present, you do it, and venous will more fuel. After, or you can use, if you don't have special device, you must use this tube. Like you can remove it only one hand. Now I can show you like it must be. Lay this tube around, turn this tube around the hand, and after that understand, yes? When you'll need, you can remove it using only one hand. After that, you ask your patient, please squeeze and press your hand like fist. Or if your patient don't do it, you can have him 3 or 5 times this part of palm collect bladder in venous. After that, you palpate the venous, and only after that, with tourniquet, you start to clean it. You prepare wet sterile swab, wet special solution for skin, and pay attention, for intravenous infusion, you clean 10 by 10 and 5 by 5, but all times you move it, must be proximally. Upper, yes. You clean in this position. Take new swab and clean only 5 by 5 on the venous in this position. And take that last swab. Take under your finger, prepare a syringe. You can check absent air again, and only after that, this you or the tip of needle and scale must be parallel in one position, you see, and this part. And after that, you fasten the venous, and under angle 15 degree, 15, that's it, 1.5. You perforate the skin, feel the well of venous, so press with, and continue like parallel. If you do it like neat, you will see a drop of blood inside this tip. If you see it, you can remove. Without remove, you only make free the tourniquet. Pull the plunger to you. You again check in venous you or not. And if you see blood inside the syringe again, you with middle speed, or not very fast, administrate solution. And you see our solution how flow in the tube with trenazole. It's some mistake. Forbidden administrate all solutions. So healthy, less than half milliliter. You cannot press all solution. You stop before, and after that you press this swab on the skin. Near needle, remove the needle. How are you? What do you feel? Continue communicate with your patient. And if it's ulnar venous, you can ask your patient, please bend your arm and take this swab in this position. Only you must take. If your patient don't do it, you must press it. You can use roll of bandage if you see the bleeding continue. But more often, if after 3 or 5 minutes you see bleeding is continuing, you take new dry, not sterile swab, and make pressure bandage using stitch or using not sterile bandage.
ගහන්න එපා කිව්වා.
Now your patient
ගහන්න එපා. ගහන්න නෙමෙයි අමීරු කරලා ගත්තා.
you swap during this time.
Ma'am,
Yes.
so it can be here also. So you took now from here.
Ulnar with cubital venous in this part. If you with forearm, it's for forearm differentials.
This is forearm or ulnar?
No, now I show you yes, this part you can press it. After that you disinfection, remove the needle without touch, separate, utilizate. After 3 or 5 minutes you again control this part. Please show me your upper arm again. If you see the bleeding is stopped, you remove tube, swap tube and napkins. Ask the patient. Now you can
මම නැවුණා මෙතන දින ඔක්කොම බඩු වෙලා.
utilizate it. Check your working place. If you need after injection, you not throw napkin. There's napkin for it. You can clean this table after injection.
එකකින් වයිප් කරානේ. ඊපස්සේ ආයෙ වයිප් කරානේ. ඊපස්සේ අතට ගන්නවනේ කියන්නේ. ඒකත් අරකින් කරමලද බං?
Utilizate your gloves. Clean your hand and try down in your administration before this if you might this manipulation. Is it easy?
No, can you practice again?
Like meat? Please, you try to do it. Yes, like this. One more time.
I didn't get it done really.
Mountain down.
නෑ තව තද කරන්න කියලා.
Okay, you can do this. Same in this. But it doesn't fit. More important, what you can remove is one hand.
ඒ අතන මරුවා මම
Now
ඒක
I
ඉදරගෙන
change position our phantom in next room and if you want, you can try.